Hey guys, first time I met AJ Feely, we were at a benefit. He had this big swag bag. He had vodka in it, a gift bag.
Sure.
He said, Jen, you're on TV. Go back in. You get your bag. I came back out empty-handed. It was just for football players.
Did he give you his bag?
He did give me his bag.
Oh,
and thank you, AJ Feely.
He doesn't hear any of this, so I'll tell him.
Yeah.
Yeah. All right, here's the thing. People are going to be looking for their bags, their holiday bags. They want to get rid of everything. This place, Dr. Bernstein, we know him, we love him. He has a thing that no one else in the country has. You can't go to Los Angeles. You can't go to New York City. That thing is a one-in-a-country kind of a situation. So we'll talk about what it does for your beautiful face when we come back after the break.
All right, you are the superhero of home skincare, but you still feel like you want to look better, okay? Well, we have a new treatment for you.
Yeah, Jen's going to tell us about it in Ardmore. Jen.
Good morning, guys. We're here. We're back with Dr. Bernstein. Good morning once again.
Good morning.
Okay, so I misspoke. It's not the only one in the country, but you were the first guy in the country to get it.
The first to buy the Permea handpiece. And what is that? It's a different wavelength of laser that comes in. It's similar to the Fraxel Dual, but it's bringing a laser to more people. It's kind of in between a super strong and a home device. It's perfect sweet spot.
And basically, we were talking about this. It's going to give you a little more invasive stuff than like a facial or a chemical peel, but you can go back to work after this is done.
Absolutely. I think it's going to replace microdermabrasion and procedures like that. And the reason I think they call it the Permea handpiece, at least what it means to me, is it helps topicals, lotions, and potions penetrate better. Because, these things, when you get the right lotions and stuff, it works. And so if you want to kind of turbo boost those, to me, that's the future of where my field is headed. Combining lasers with other treatments, fillers, toxins, and topicals.
Okay, and so one of the things we were talking about as we came over here is this is the time when people want to do some stuff for the holidays. So coming up at 8:30, we're going to talk about some things that you can have done here, and you will look super fabulous for the holidays. And then we'll see how she's looking because she's going to get treated, right?
Right. The clear and brilliant Permea handpiece, you're going to see the results right here.
Okay, so guys, back to you, and then we'll show the before and after so you can see all of that stuff. But look at her; she's not even flinching. Way to go, Jerry.
Treatment on your lunch
break. It doesn't hurt, right?
We'll take a look at her about 30 minutes here. Got to tell you this. Hey, good day to you. It's Friday, it's November.
All right, Jen Frederick, what can we do to be fabulous on our lunch break?
As you can see, we're not showing you the results. We just did some clear and brilliant on Jerry. And let me tell you, she looks clear and brilliant. So coming up after the break, we'll take the towel away and we'll tell you a little bit about it. Jerry's smiling. You're awesome. We'll be back right after the break.
But many people want to look a lot better, of course, but a lot of people are afraid of the pain that you go through if you go to a plastic surgeon. Not to necessarily get plastic surgery, but some of the treatments.
Any kind of a procedure, they're worried about it. So Jen Frederick, you're here for us today. You found a solution, perhaps?
You know how Mike Jerick is in love with Nurse Kim? Nurse Kim that was in Oprah Magazine?
Love her.
Hi, Nurse Kim. Hi. This is her page from Oprah Magazine. And you know what she says in Oprah Magazine? That she uses this sucker to look so good. Good morning to everyone. So this is clear and brilliant. So let's do our big reveal. Dun, da, da, da. Okay, so Doc, what we're looking at, her face looks a little red.
Yeah, it's perfectly pink. It's kind of like if you were outside in the wind, really. And you can ask her how it feels.
How does it feel? A little warm. Okay. And what you're doing with this is for someone who's already on their A game with their skincare and they just want to boost it up a little bit.
Well, yeah. I mean, you're going to rejuvenate the skin. You're going to improve pigment problems. You're going to improve enlarged pores. You're going to improve fine lines and wrinkles.
We have some before and after pictures as you're talking about this. You bought this thing and you have this specific hand unit. What do you call it?
Right. It's Permea handpiece.
Okay, because you think this thing can help you get deeper into the skin?
Well, I think it helps topicals get into the skin better. And
that's real people talk for lotion?
For lotion, skin lotions, right. And today, skin lotions have real science. I mean, companies use tons of scientists to develop these products. So the better they get in, the more they can do their work and do their good stuff.
I have to say, your skin looks pretty nice today, Doc. Dr. Bloom is here as well, because one of the things is it's November. We're 2 weeks away from Thanksgiving. The holidays are in December. A lot of people want to come in and just look a little better. So we'll kiss and tell. Nurse Kim, she's in Oprah Magazine. Dr. Bloom, he's in Allure Magazine, and you were there for lip fillers.
Yeah, they were asking about things that people are doing now for to spruce themselves up for the holidays. So we had some before and afters of some people that we did where we augmented their lips just slightly, normally maintaining normal proportions, and it was in the magazine.
Okay, so Karen's going to be our victim, and one of the things that you're doing is you're using a new needle that is less painful, not a lot of bruising. So coming up at 9:20, we will have seen her, right? So we should look at her now. Smile for us.
Yep, we're gonna augment her lips with a little bit of some filler, and we're gonna use, as some of my patients call it, the nifty needle.
Really?
Yeah, it's great.
And we're gonna show why that doesn't hurt so much.
Exactly.
So I look at her, quite frankly, and her lips look great. What is it that she? I'm talking about you like you're not here. What is it that she likes to achieve? What are you going to make her? What will make her look better?
Well, we're going to outline the lips a little bit, give her a little bit more definition, give her a little bit more volume to the lip body, maybe a little bit more pout, which is actually showing a little bit more of the lip itself, like rolling it out a little bit, but maintaining the same proportion that she's got. You can see that the bottom lip is still 2/3, and the top lip is 1/3. That's normal proportion to the lip.
You won't give her like 4/3 of a top and nothing of
you don't want a huge top lip. I call that trout pout.
Trout pout. All right. So again, if you want to be Nurse Kim, and who doesn't want to be Nurse Kim? I'm so mad at Nurse Kim. She's 42 years old, people.
For the love.
I just want to go like this with Nurse Kim. I'm kidding. I love her.
She's gorgeous.
All right, so coming back at 9:20, we're going to not do the trout pout.
We're going to do lips next time.
So you're going to do it now?
He's going to do it now, and then you don't want to see that on TV because that's Cheerio time. No.
Well, it is
she'll
actually
be hot after.
It is a needle going into her lips, isn't it?
Yeah, we're not going to show that.
Don't show it. I've had that done one time as a segment on TV. Yes. Oh, my God. We'll talk about it later. Thanks, Jen.
You have a picture?
Incredibly painful. Yeah.
Let's talk about President Obama.
Here's Jen.
All right, so here's what we're doing. You can't see. Look, coming up after the break, Karen had her lips done. They look awesome. And she's smiling, which means it didn't hurt so much. We're going to talk to you about it when we come back after the break. Because a lot of people won't do it because they think it hurts. We're going to talk about why Dr. Bloom keeps her smiling. How you keep her smiling after the break. It's a little needle scene.
Last hour, Jen introduced you to a woman who said she'd like to have fuller lips. An hour later, does she have fuller lips? Jen's in Ardmore.
She certainly has the giggles. This is Karen, Dr. Bloom, Dr. Bernstein. Good morning to all of you guys once again. All right, so let's show the before of Karen's lips. Do you guys have it? You're going to tell me in your ear. Those are the before of Karen's lips. And then, da-da-da. She's sexy and she knows it. That's the after of her lips. Now, first of all, you're smiling. A lot of people don't do this, quite frankly. Sorry. Because they think it's going to hurt like heck. It was okay.
It was fine, really. It wasn't. Initial one feels a little like pressure in the lip, but that's it.
Okay. Yeah. And one of the reasons, Doc, why there's no bruising, she's a little puffy now, but it'll settle in over the next couple days?
Yeah, she's a little bit swollen. I tell patients that if you like the way it looks, I have them look at it as I'm doing the injections. I put a little bit more in because there's always some swelling, and the amount of filler actually goes down over time. She has zero downtime. She already put some lipstick back on. She's ready to go.
And one of the reasons why you're able to do this so quickly, so pain-free-ish, is this needle. And Dr. Bernie, he's going to be our, basically, you're the supermodel. So this is a traditional needle right there. As you see, it goes right into the wow, just because that's super sharp?
Yeah, it's a sharp needle. If you hit a vein or something like that underneath the skin, which you can't see, you get some bruising. With this blunt needle, I only make a tiny little poke in the skin, and then the cannula, which is this needle, is flexible and is not sharp. It's blunt on the end. So if you hit a vein or something, it just pushes it out of the way.
So we don't want to freak people out. That's why we didn't show. But I sat in here and watched, and I was a little nervous for you. But so you basically wiggle it in and out of her lip, and it's flexible, and that's why there's no bruising, no bleeding.
Exactly.
Okay.
She looks great, and we just did this.
So you're going to look great for Thanksgiving. High five up top. That's why you did it, right? Yeah. That's a lot of people are doing little tweaks like this. We're going to show a picture of the nasal labial fold. That's another thing people can do this time of year to look a little bit better for the holidays.
Right. This is commonly done. This is the parentheses that people see. We actually make two little pokes in the corners of the mouth and are able to do this with that same needle and they walk out and they're ready to go back. It looks great. Just a little bit of something special for the holiday season. These fillers last for about 6 to 9 months, so most people get fillers about twice a year.
And basically, you love this needle because it makes it less painful and all that.
Absolutely. We just put a little bit of topical numbing medication on the skin. We take it off after about 10 minutes, and we're ready to go.
All right. If you were David Beckham, I would kiss you. But you're Karen, so I'll hug you. Thank you so much for your help. Guys, how cute is that? And again, she literally did it at 9 o'clock this morning.
Oh, she looks good.
It looks great.
I think
Beautiful
so.
smile. Way to go, Karen.
Yeah, great personality helps too. That's nice.
Thank you, Jen.
I don't believe, though, as a man, I could do it.
The pain.
I can't take any pain. Oh, there's Jason.